over time, that can really do a number on your digestive system, cause ulcers and all kinds of issues. Not to mention the fact that you're not addressing the cause of the problem, and that could lead to further arthritis in the back. And then stenosis, where the bones grow out and it's always pinching the nerve. And then the only treatment at that point is surgery. So if it's ignored and you're just kind of treating the symptoms, it could get bad.
Stenosis, the bones they grow and poke the nerves.
That's right. Yeah, it's what most people call arthritis, but the bones actually grow out to try to stabilize that area there. Yeah, you got some interesting images. Yeah, that top one you see there on the left. Um,
This one?
no, yeah, that one. Yeah, that one right there. So the bones can actually fuse over time. So now you see the nerve has very little room. That second image at the top.
Oh
Yeah,
my.
yeah,
That's crazy. I didn't know we're capable of doing that.
yeah. Your body will adapt to that too.
That's
So
so crazy. Look at this one. So
yeah.
so why?
So
Go ahead. I'm sorry.
in that image, you see a herniation there, where the disc is bulging and then compressing the nerve. But the bones can also grow and compress the nerve, and that's constant pain. And then at that point, the only thing you could do is see a surgeon where he's going to cut out a piece of bone to open up that space so that the nerve isn't compressed all the time. But now your spine is weakened because it's missing a part of of the bone. So yeah, if you're just treating the symptoms, things can get bad, and it takes time. It's not going to happen overnight, but it'll happen over, the next decade or two, where you wake up and then you're like, I can't do this anymore. I can't drive my truck, or I can't have this blue collar job because the pain is severe and you need some severe form of treatment.
I can only imagine how long does it take to actually figure it out what's the problem, because it seems to be hard to find out, right, what exactly is going on. There's so many tiny pieces of the bone, the nerve, the joints, and like I guess it's like is an arduous learning process and searching process.
Yeah, and I
Yeah.
think that's another reason why you should see different types of providers. You see your medical doctor, he recommends an MRI or an X-ray. You'll have some great information there. And you see a chiropractor who kind of focuses on restoring that motion, getting that pressure off the nerve. You know, you'll definitely be able to get to the bottom of it.
I saw recently on Instagram a guy, he passed away, but apparently he had some type of disease that made the bone, like the his skull, to grow, like the face bone to
Yeah.
grow. What is that?
I forget the term because it's not very common, but yeah, the bones. There is a condition where the bone can grow in the skull specifically.
I'm gonna try to find it because it's I never seen such thing before. I don't know if I can find it right now. I'm sharing the screen, everyone. That's not it. So face bone, like skull. Let's see, bone expansion. If anyone knows, just let us know in the comments. Maybe this was 3D reconstruction of CT of the face showing the bone expansion. Gosh. I guess this hurts. Oh, there you go. Computed tomography. Let's. Oh, security check. That's weird. But we found it. Like, it's something like that. I guess it would hurt less on the face because there. Are there less nerves on the face than compared to the colon?
No, but
No?
if it's the skull, there isn't a lot of nerves on the skull. The nervous system is inside, so if it's growing out, it won't cause a lot of pain.
Damn. That's crazy. Dude, I don't know how you do. I remember as a kid just the idea like of seeing blood and not blood but like parts of people open, like I couldn't take it.
Yeah,
I think it takes a special kind of personality to be a doctor and to be, you know what I mean, to be in this world. And I, I don't know, it's crazy.
Yeah. Well, when I was in chiropractic college, we were dissecting humans.
Oh my
Uh,
god.
but after that, we really don't deal with open wounds. So, once you graduated and you're done, you're good.
Yeah. But I mean, you're from New York. How many accents there? I guess a lot of your patients are just people who got in car accidents, right?
Yeah, I mean, we treat patients who've been in car accidents. Usually, though, not open wounds.
No.
More like neck pain, back pain, that kind of stuff.
I see. I see. We had a chiropractor on the show, I think this year, not long ago. And we were talking about how famous some of them are on TikTok because they have those tables who just